Hello, I'm going to be doing a video on the correct way to draw blood. My name is Jessica Zimmer and I'm going to school to be a medical assistant, and I've already completed the phlebotomy course, so I have my phlebotomy technician license. The first step to drawing blood is you always wash your hands. You have to wash your hands at least the amount of time it takes to sing happy birthday twice. Sounds silly, but it's an easy way to remember it. When you sing happy birthday twice, you're making sure to get rid of all the germs that are in your hands, in between your fingers, and all the places in which you could spread it to the patient. Step 2 is to identify the patient. You always want to check the patient's identity by at least 3 ways. You do not say the patient's name, you ask them and make sure that it fits to the patient's chart. Step 3 is to identify yourself. You always want to help the patient feel comfortable before the blood draw, especially if they have a fear of having their blood taken. Next is step 4. You check the patient's chart to see if they should have been fasting before doing the blood draw. This would be very important because if they had eaten when they're not supposed to, it could change the results of the test itself. Step 5 is to put on gloves. Act confident. Education plus experience equals reassurance to your patient. Then you position the patient in which way you're going to draw the blood, followed by assembling your instruments that you're going to be using and making sure to check all of the expiration dates on them. Then you apply the tourniquet. You want to make it tight on the person's arm so it cuts off the circulation to make it easier to draw the blood. And when you remove it, it's easy to remove. Have the patient close their hand. Never have them pump their fist like they used to do, because it's been found to make the blood clot quicker, making test results inaccurate. Then you select the site to insert the needle, followed by cleansing the site with an alcohol pad. Then you anchor the vein using only your pointer and thumb to draw the skin tight underneath the site. Then you perform the venipuncture at a 30-degree angle. After that, you release the tourniquet, making sure to never leave it on for longer than a minute. Making sure to fill the tube until it's full before removing the needle from the vein. Then you remove the needle swiftly and apply direct pressure for several minutes. Then you rotate the tube itself for 30 seconds to make sure that it does not form blood clots. If it were to form blood clots, that would throw off the results to the test itself. Then you dispose of the used equipment in a puncture-resistant biohazard container. Then you label the tubes, making sure to do it before you leave the patient so there can be no mistake or unlabeled tubes. Then you remove your gloves and wash your hands. Washing your hands after these labs are one of the most important things to preventing the spread of germs. Let the nurse know at the nurse's station that you've drawn the labs and that you're sending them down to the lab itself. And that's it. Drawing blood has come to be a fun experience for me, and after learning how to do it correctly, I feel that I as a medical assistant can go on and do it to patients in the future. Thank you for this class in helping to make me more confident in public speaking. Working in the medical field has a lot to do with being able to sound confident and factual to the patients that you're taking care of, especially if it happens to be an infant who doesn't know what's going on, or a child who only knows that it's really hurting them. I hope to one day be a medical assistant that a patient asks for when having their blood taken, and to continue to improve on drawing blood so that I can cause the least amount of pain as possible for my patients.